And concluding our session today, we have Gaia Dempsey. She is the co-founder and director of marketing and PR at daqri. Before joining daqri, she co-founded interactive and digital marketing firm Demeter Interactive. She began her startup career at Idea Lab. And might I also add, daqri is the title sponsor of this event here today, so she is largely responsible for the scale and success of today's event. Thank you very much.
Gross overstatement. Thank you, Chris. Okay. That's not good. Okay, we'll just go without notes. Could you? Thank you.
Sorry, I'll leave it down. There you go.
Thank you so much. Okay. Hello, everybody. Thank you so much for joining me for this talk on medical applications of augmented reality and 4D technologies. I'm honored to be here at the Augmented World Expo for the third year in a row, and really believe strongly that augmented reality is going to enable some major advancements in the field of medicine. So I'm glad that I have the opportunity to talk about that today. Before we dive in, I'll just give a little bit of background about myself and about daqri. I grew up in a household full of medical professionals. So throughout childhood and high school and college, I went to a number of medical conferences, talks. I worked in doctors' offices when I was younger, and actually went through a period where I believed I was going to be a doctor and took a lot of classes around that. So this is a topic that's near and dear to my heart. I've been very interested in the places where medicine and technology intersect, and I find those places very fascinating. So I visited a virtual reality lab. This is an example where technology can help people that have suffered trauma heal through virtual reality. They can go back to painful experiences in a safe environment and actually work through them in a therapeutic setting. I'm also a strong believer in biofeedback and the quantified self-movement. So this is actually my personal Fitbit data from last Friday. As you can see, I didn't quite make my goals. Here's my data from Saturday, the next day on the weekend. I had a little bit more time and tried to make up for it by going on a longer hike. So that's a little bit about me and my interest in medicine, health, and technology. I've also been really interested in augmented reality since the moment I started learning about it, and been fortunate to be with daqri for since the early days. So daqri, if you're not familiar with us, we provide custom enterprise software solutions as well as end-to-end creative services. We serve a number of industries, including industrial, education, media and entertainment, gaming and play, and of course medical. And today we're going to talk about a couple of real-world examples from the daqri portfolio where we've worked with companies that are in the medical field. So today we're going to look at several key questions. I believe that augmented reality is going to have, a major impact in the world of medicine. So we'll talk about, can augmented reality enable the average person to be healthier, and if so, how? How can healthcare professionals use the technology? Can augmented reality help patients, physicians, and institutions make better decisions about healthcare? And what kind of impact will augmented reality have on the healthcare ecosystem as a whole, and how will that affect that? So we'll look at these four main areas: medical practitioners, researchers, and medical school institutions, and patients and the consumer. But before we dive into those areas, I want to address a fundamental question. Why augmented reality, or as we call it, a daqri 4D? It's a little bit different, and I want to just take a moment to make the distinction. 4D is related to augmented reality. It uses augmented reality as one component. We call it 4D, and that implies to us that there's a component of interactivity and that it's a fully designed experience. Augmented reality is just the technology that allows you to recognize an image and insert some kind of digital content over that into the real world. 4D is a little bit deeper. It involves experience design and interactivity. So I just want to make that distinction early on. So why 4D? Why is this applicable to the medical world? First of all, it allows you to visualize complex systems. It allows you to rapidly comprehend interrelationships between interrelated variables. It provides a functional and motivational interface that can host companion apps that can be called upon at the right time and place. So you could be at the scene of a medical emergency, you may be at a doctor's visit or after you leave the doctor's office, or just in your everyday life when you're making decisions about your health. And those interfaces can be deeply integrated into the surrounding context, the environment that you're in that moment. So these 4 qualities make augmented reality very appealing to any number of industries, but they also happen to be what makes it relevant to the medical world. And today we're going to look at some really specific examples of why that's the case and how they apply. So I'd like to start out by talking about tools for physicians. I think this will be a great place to start, and we'll look at physician-patient interactions and where 4D can fit into those interactions. So when we talk about rapid comprehension of complex systems, visualizing complex systems, where does that apply in the medical world? You could be a physician that's trying to explain a diagnosis to a patient. You could be explaining lab results, trying to understand prescription dosages, a treatment modality, preventive care, and 4D can give you accessible, actionable data in the moment that allows patients, physicians, and medical institutions to share data between them and understand each other better. So as a concrete example, let's look at a specific diagnosis, and we'll walk through it. Does anybody recognize this image? So let's say that a patient has been diagnosed with osteoporosis, and their bones have a density shown in this photo. This may be a T-score of negative 2.3, let's say. And they're in a relatively stable condition. Their condition can be managed. So it's your job as a physician to communicate to them where they are in terms of their medical status, and also what they need to do in order to prevent it from getting worse. So you know that because of their perhaps genetic predisposition or their lifestyle, that this 2.3 could very easily swing down to a T-score of negative 2.8. Now, if you're the patient sitting in the room with the doctor, you may think, 2.3 to negative 2.8, it's very abstract. I don't quite know what that means. And it also seems like it could be fairly negligible. It doesn't seem like a very big difference. But if you give them the visual understanding, you can really quickly help them see that this is a lot worse. And when you're sitting in that doctor's office, you as the physician have years of training, and you also have years of intuition and experience built up by seeing patients. So you know that the difference between negative 2.3 and negative 2.8 is exponential when it comes to the risk of creating a fracture if you were to fall. So here you are, this is an example of a simple interface that could be pulled up on a lab test while you're talking to the patient in the office. Here you are safely at negative 2.3, but you could very easily get down to negative 2.8 if you are not to follow the treatment plan that's recommended. So the physician's goal is obviously to help the patient really understand the risks associated with their condition. And if the patient can remember this, we talked about 4D as a communication medium that allows you to understand information more rapidly and also retain it for longer. So when the patient walks out of the doctor's office, this information will be imprinted in their memory, they'll remember, and they'll be more likely to follow the treatment plan that you're recommending. And this type of example could apply to any number of diagnoses. So this is an example that kind of visually represents what that could look like in the setting of a doctor's office, explaining a lab result that's coming back, and also after the patient leaves the office, their medication packaging could be enabled with 4D technology. It can give you dosage instructions, visually communicate warnings, can also do things like send medication reminders through your smartphone, or in the not too distant future, a device like Google Glass or another notification-based device. So I want to talk about the first case study that is from the daqri portfolio. This ability to rapidly communicate information was very attractive to one of our customers, LifeNet Health. So LifeNet Health is a leading provider of organ donation and tissue banking services, and their bioimplants division wanted to teach medical professionals about their graft chambers, bone marrow aspiration needles, and specialty implants for spine surgery. And they actually wanted to take this new product offering to medical conferences around the country and talk to physicians and healthcare professionals about this offering and help them understand it and how it would help their patients. So this is a visual example showing a flyer that was enabled with 4D technology. It shows their cervical implant and cortical end plates and how they are inserted into the cortical spine. This helped physicians gain a deeper understanding of the clinical technologies that LifeNet Health offered. This was animated, and they were able to keep the flyer and take it home with them and really rapidly understand a system that would have been a lot more difficult to explain in words. And the ability to move around and look at this complex information from multiple angles has been shown to really help the person understand it better and remember it for longer. So everything that we've talked about so far in terms of physician tools are things that are squarely in the realm of the possibility today. As you can see, some of them are already being done. And so for a moment, I just want to consider what's possible in the future. This is a very striking image that shows an ankle that's being sort of viewed with X-ray vision. This is just a prototype, but with Connect functionality and a real-time visual overlay of the patient's body could be in our future. And I think it could be very helpful for both the patient to understand their own diagnosis and for the doctor to have a complete visual understanding of the patient in real time. So again, this is a prototype, but it could be possible down the line. Next, I want to talk a little bit about medical institutions, how 4D technology and augmented reality can help medical institutions. So augmented reality, we've talked about it as the user interface for the Internet of Things. It helps you, you imagine you're wearing Google Glass and you look around and different objects in the world around you have data that's associated with them that help you understand anything that you're looking at any given time. Why wouldn't this be possible with medical data, medical records? The patient themselves could have their medical data attached to them. So how is this possible when we have medical data that's siloed around the country, and almost every county has their own data standards? So there's some movement in this world, just like other industries have moved toward interoperability. This is an example of interoperability that's becoming possible in the medical world. This is the Care Connectivity Consortium. It's led by the Mayo Clinic and Kaiser Permanente and a few other organizations. And it's really groundbreaking. It's setting the groundwork for the first ever nationwide interoperability standards, technical, semantic, and process in terms of medical data. So this is just one example of how data is becoming more accessible and more interoperable around the country. And if this system were fully implemented and had a 4D interface associated with it, you could go anywhere and really have your data follow you and share it with your medical professionals at your discretion. Another example that is relevant to medical institutions, there's a lot of costs associated with miscommunication of information between medical professionals. So there's a study that was done, miscommunication or lack of communication. There's a study that was done in 2011 that looked at several thousand doctors and specialists. The salient points are that 69% of primary care physicians said that they always or mostly passed on a patient's history and reason for a consultation, whereas fewer than 35% of the specialists that they were referring to reported always or mostly receiving that same information. So that's not a great ratio. On the flip side, specialists, of course, we know better. they said that 81% of the time, of course, they always or usually send their consult results back. Only 62% of doctors reported receiving that information. So where did the information go in the middle? We don't know. But an instantly accessible 4D interface that can not just communicate information on the fly, but also receive on-the-fly input from doctors and physicians and make it much more likely for them to communicate the results of a consult instead of having to go to their computer and dictate and have somebody type that up. A 4D interface that is persistent with the physician and then also persistent with the patient would help with this lack of communication issue. So now we'll look at quickly medical school and medical research. There's some interesting forms in prototype form that exists today. I'm just going to look at a couple of examples. PalpSim is a very interesting example that utilizes not just augmented reality, but also robotics and haptics. So in this image, you're seeing a medical student that is learning about the femoral artery needle insertion process. So underneath this this augmented system, to them it looks like they're interacting with a patient in an operating room. Underneath that, their hands are, and they have, sorry if you can tell, those are not their real hands. It's tracking their hands and inserting representation of generic hands. And this is where their hands are underneath that interface, interacting with a robotic system that has incorporated haptic feedback. So it's teaching them visually how to do surgical procedures that would be difficult to test on a live subject. And the augmented reality component makes it feel more realistic and better prepares them for the operating room. This is another example of a similar training scenario by a group called MITK Peel, and they're a research group in Germany. So again, this is another example of augmented reality helping surgeons prepare for the operating theater. This is back to the idea that you could see an augmented layer of information inside the body. This is a Connect hack that was created that allows you to not just see your internal systems, but also through gestures reveal slices of the body in different directions. So we'll go to another example from the daqri portfolio. This is called Anatomy 4D, an app that we released last year. Right now it has over 250,000 downloads, and we've found that it's been very interesting to medical schools around the country, and we've also received letters from medical students and nursing students saying, this is what I use to study, and can I buy a target image from you? And we say, well, we make the software, but we'll send you something so you can print out a target image. And I'm just going to play a short clip for you to understand a little bit about what that looks like.
I'm Gaia Dempsey from the daqri team.
So I wonder if I can skip ahead. This video is also available on our YouTube channel if you're interested in hearing all of the details, but I really am interested in you seeing the interface in action. So this is a life-size target image that allows you to interact with the different layers of the body systems and really understand them visually, spatially, and kinesthetically, and really rapidly gain a level of comprehension that would be difficult to achieve with just a textbook. So that's probably enough. I want to end on the quantified self movement, coming back to the consumer and the patient. How does all of this play out in our everyday lives? Everybody is familiar with the quantified self movement. There's the Bluetooth-enabled devices such as the Fuel Band, the Fitbit, which I personally use. Are now pedometers that are natively embedded in our cell phones, the Galaxy S4, and pretty much every Japanese cell phone on the market has a pedometer that tracks your steps. EEGs, consumer-priced EEGs, so you can really track the food that you eat, your fitness level, how much you sleep, your brain waves, your mood, and I believe that Google Glass is a way that all of this data is just going to become more accessible. You can't manage what you can't measure. You can't manage what you can't, out of sight, out of mind. So putting that information in a more accessible place is going to help people make better decisions. I also think that augmented reality is going to help take much better measurements of all of these categories. So what makes me believe that people are ready to interact with medical data on a mobile device or in an augmented reality interface? It's a very private thing, and yet studies show that chronically ill patients, including people with diabetes, are much more likely to use a mobile app today to manage their disease, and patients prefer PCs patients prefer mobile devices over PCs for interacting with their healthcare providers. There are some examples such as Kaiser Permanente and the Microsoft Health Vault app where people can access their medical records. You can make appointments with your medical provider. You can order a refill of your prescription all via a mobile app. So these are really encouraging signs that to me point to augmented reality and 4D as a viable mechanism for interacting with your medical data in the future. And I think that what's really possible, and we don't know what this looks like yet, we don't know exactly how this will be delivered, but a persistent interface that shows your health stats in a dashboard that you can customize. You can look at your blood pressure, perhaps the number of steps that you walked in a day, reminders for your doctor's appointments, your prescriptions. Here's a notification that your prescription is ready for pickup. Here's your mood tracked in correlation with what you've been eating so that you can make better decisions about your food. And all of these are possible places where you can interact with your health data in a 4D interface that is with you all the time. So I would love to hear your thoughts on medical applications of augmented reality, and you can reach me on Twitter at Fiongsu and daqri. So thank you so much for your time.
Do you have any questions from the audience? Anyone? Going once, going twice? End of session? End of day? We have one. Ika.
Hi, how are you doing?
Good, thanks.
I have a client. We have a marketing agency down in Mexico, and we have a hospital as a client. And what they want over there is, some of the studies like X-rays or nuclear medicine studies and stuff like that, they become like a sheet of paper. That's how they deliver you the study, right? So what they want is to have a blend with the augmented reality, where they can point out to the image, and then you'll get like a superposition of images between the study and the anatomy software you have. You think that would be possible?
Absolutely, yeah. I think
and
MRIs...
you would be able to point where the malfunction is with an arrow, with a finger, with something?
Definitely, I agree. The question for those who couldn't hear is it possible to augment things like MRI or X-ray data, things of that nature, cardiac stress tests, brain scans, where you're interacting with a complex medical graph are ideal for 4D interfaces, and being able to really pinpoint where there's an issue can help the patient understand the diagnosis much better. So definitely that would be a great application.
Especially, you have the patient, that you got to explain what's happening, and there are some specialties like nuclear medicine where the patient is another doctor, that you got to tell him what his patient has. I don't know if I made myself clear, no? So you got to explain with this, so you'll get into that medical detail. I don't know if I made myself clear. So you have you have like two customers. One is the doctor that sends you the patient, and the other one is the patient of the doctor. So
I do think that it would be applicable in that case as well. And if you're interested in chatting offline, I'd be happy to talk more in depth.
Any last questions? Going once, going twice? All right. Thank you so much.